I'll pop back in at the end of this. So let's first of all figure out who LifeX is. LifeX Research Corporation is an established health data research company. LifeX recruits very part-time employees. That's what your customers who buy your health insurance plans, that's what they are called under LifeX verbiage. And LifeX calls them research associates. I'll explain that in a minute, or RAs. And these individuals remain fully employed or self-employed elsewhere. LifeX does not in any way at all replace their current job. So what do research associates do, which is what your clients would be? What do they actually do? Well, research associates participate in ongoing health studies by providing anonymous health and consumer insight data. So they get paid $40 an hour proportionally. They get work assignments, which is filling out surveys and providing personal information. So if they spend 15 minutes 1 month doing it, they'll get a check for $10 minus taxes. Yes, they get a W-2. This is a real job. And like most jobs with major corporations, as an employee, you qualify for group health benefits. And that's how it happens. That's how they have access to the health benefits that you're going to provide them. So the time commitment, as I said, is minimal, typically 15 minutes or less. It's all done online. They can do it anytime, anywhere. It includes questionnaires, wellness activities, educational health exercises. And upon becoming an RX or LifeX W-2 employee, they get that access to that group benefit. So the reason that works is the data collected by LifeX helps medical providers and public health researchers identify patterns, improve outcomes, design better health strategies, and importantly, all data is aggregated and anonymous. No personal health information is tied back to the individual. Your customer, who in LifeX's verbiage becomes a research associate, are actual W-2 employees. Yes, they get a W-2 each year. They're paid through a national recognized payroll company, ADP. I'll show you that in a minute. Taxes are handled properly at the federal, state, and local level. And this matters because employment status is what creates access to employer-sponsored benefits, which everybody likes to get. Now, that should lead you to the next question, which is, who is this good for? Let me bring all this under an umbrella for you. So you have LifeX. I've told you who they are. They work with benefit health plans, who's the third-party administrator. They use KMG Services as the billing and technology service provider. The research associates, your clients, are paid through ADP. And the recruiting, which is what I'm doing right here, is done through Network Pro's recruiting entity. So why LifeX? Well, LifeX combines health research, wellness, tools, and benefits access into one ecosystem. It's designed for people who want better health outcomes, predictable costs, and an alternative to traditional ACA plans. Remember, as a benefit of employment for your clients being research associates, they can choose to purchase the employer-sponsored group health benefits offered by LifeX. This is the core opportunity for you as an agent, helping qualified individual access non-ACA employer group coverage. So LifeX offers a robust mix of employer group health benefits, including preventative benefits at no cost. These plans are administered by Benefit Health Plan. I showed you that earlier, under a self-funded employer structure. They get employee wellness and incentives. Your research associates, your clients gain access to wellness tools designed to improve overall quality of life. They can also earn guaranteed compensation for completing health activities like surveys and quizzes. And all plans include 24/7 telemedicine with licensed providers. This includes urgent care, primary care, behavioral health, and it's offered with zero copays. So who's this a fit for? Like if you designed your primary prospect, like the prospect that is most likely to be looking for these type of health plans, then it would be those individuals with no access to benefits through their current employment, those who did not receive ACA subsidies, gig workers, 1099s, self-employed, and those who are an uncovered partner of Medicare. So who's eligible to be that part-time employee? Which one of your customers can be a research associate? Well, eligibility requires a willingness to provide health and consumer insights throughout the year. Applicants and dependents must complete a health questionnaire to determine their eligibilities. So what does that look like? Just like any health application, any health plan you've ever sold, they fill out an application, right? Well, here's what it looks like. So the research associate, your client, completes an employer application and an assessment questionnaire. This establishes eligibility and confirms participation requirements. I'll leave it on the screen so you can take a quick screenshot of it. That's part A. And you see all the questions are yes and no. That yes, they do have to say no to all. And you continue to part B. You see what part C is. Pretty common type of questions, right? So they have to answer no to all of these questions, and then they qualify to become a research associate. And as an employee of LifeX, they now have the ability to purchase a group health insurance plan, and we're going to look into those next. But here's what happens when they come on board, when they buy that health insurance plan. They get their own client login where they can access their benefit card, claim forms, FAQs, pharmacy benefits. Everything's already on there for them. All the data that's collected is on there for them. It's a great login. They can manage all their health benefits right from this website. They can do all their assessments from here. Everything can be done right from one login. And the group health benefits that they now have the opportunity to purchase are available in all US states except 8. That's Hawaii, Alaska, Washington, Oregon, Minnesota, Maryland, New Hampshire, and Vermont. I'll say that one more time for you. All US states except 8. Hawaii, Alaska, Washington, Oregon, Minnesota, Maryland, New Hampshire, and Vermont. And on their own platform, they get their ID cards that list LifeX as the employer, with Benefits Health Plan as the administrator. The cards display the network affiliation, the member number, the PPO, and the EPO logo. For EPO plans, which is what I'm going to show you today, they have in-network care. Some plans allow out-of-network care at higher cost. Emergency room services are always covered per the guidelines. And you, as the recruiter, that's what you're called, not an agent, but a recruiter. You, as a recruiter, have your own training platform, your own contracting platform, your own enrollments, your own back office. You have everything. You manage your entire book of business right from here. And of course, dependents can remain on the plan until age 26. Deductibles apply per covered person with a family maximum of 2 times the individual deductible. So let's look at the plan I'm going to show you today, which is the EP plan. So the reason we're going to look at this is we want to figure out, what do I pay first, the deductible? What do I pay after that, copays and coinsurance? What's the most I can be on the hook for? In other words, my out-of-pocket maximum. And of course, we want to know what's covered, under what rules, network plus services. There's nothing exotic or hidden in these slides. They function the same way most employer EPO plans function. And this is the plan overview. This compares the 500, 750, 1,000, and 1,500 plan that you have available to offer your clients. It shows the out-of-pocket maximum, office visit cost, emergency care, and prescription drugs. I'm going to show you all of that. In other words, we're simply saying, here are the same plan, the same network, the same rules, just with different costs and different sharing levels. Nothing else changes. The same employer, the same EPO structure, the same network, the same eligibility. Only how costs are split between premium versus deductible changes. And what the deductible means is it's the amount you pay out of pocket before the plan starts sharing costs for services. What the out of pocket maximum means, this is the absolute worst case scenario in a year for in-network care. Once you hit that, the plan pays 100% of covered services for the rest of the year. So if you have a $500 deductible and a $3,000 out-of-pocket maximum, you break your arm, you pay up to $3,000 total, not unlimited bills. This is the real insurance, not a discount card. This shows you what the normal office visit cost, specialist visit copays. In other words, after your deductible, or sometimes even before, depending on the services, you pay set copays, not mystery percentages. Example, you visit your primary doctor, instead of the $200 bill, you pay a flat copay like $30 or $50. The plan handles the rest. This is why people like EPOs. It's predictability. I'm going to show you the next slide so you can see with the 500, the 750, the 1,000, and the 1,500, what your copays and deductibles are under all the various options there. This is exactly what people are looking for. And this is why when people don't have ACA plans and they feel like that they're being dinged for so much out-of-pocket cost, that a plan like this is a perfect fit. In fact, it does include the preventative services with zero copay and zero deductible. It includes maternity, home health care visits, durable medical equipment, prosthetics, allergies, and it has a built-in prescription drug program for it. So everything that you would want for your clients to have, you have the chance to offer them by them just being a part-time employee with LifeX. It's a great option to have. Now, a lot of times there's confusion over when the plan starts. Coverage always starts on the first of the month. The first payment is made at enrollment, and then ongoing monthly payments are charged around the 15th of each month. If someone enrolls on March 10th, their coverage starts on April 1st. The first payment covers April. The April 15th payment is for May, etc. And the reason they do this is this structure reduces lapses, allows time to fix failed payments, and is common in employer and employee sponsored programs. So what we're really doing is we're saying here's the same plan, the same network, the same rules, just different costs. The same employer, the same EPO structure, same networks. So what do you pay before the plan really helps? What the deductible means, the deductible is the amount that your clients pay out of pocket before the plan starts sharing the cost. This is a great slide. It shows you an overview of the 500 to 750, 1,000, and 1,500. I'll give you a second to look at that. In fact, I showed you back here on the drugs. You have generic, preferred, non-preferred brand, and specialties. And that means cheaper. Sorry about that. I keep moving my slide over. Cheaper common drugs equal lower costs. More complex drugs, of course, that means higher costs. It works just like most employer plans work. Not every drug is cheap. Specialty meds can be expensive. But you should always check the prescriptions in advance. There is no everything is covered promise here. And that's the honesty of it. So just to go over the fine print, the EPO network rules, if in network only, except true emergencies, no routine out of network benefits. Emergency room visits are covered even if out of network. Provides preventative services covered at no cost. That includes annual physicals, screenings. The elective procedures have a waiting period the first 90 days. Emergencies, of course, do not. The plan works great if you're willing to stay in network and plan your care. It's not built for people who want to see any doctor anywhere. This is a normal employer style EPO plan. You choose how much risk you want up front. In exchange, you get predictable cost, real coverage, and a cap on worst case expenses as long as you stay in network. So here's what you need to do as the agent. I'll put that slide back up there so you can compare the cost. is tell your prospects it's an EPO. In-network care matters. Deductibles different by plans. I've shown you what those were. Hopefully you took a screenshot of it. There's real cost sharing. It's not fake cost sharing. There's real cost sharing. It's not ACA. It's not short-term care. Not universal acceptance. So it's a standard employer EPO plan. You're just choosing how much you pay up front versus monthly. So they need to stay in network. And I'll go through some of the most frequently asked questions that we have. When are future payments charged for the first payment at the time of enrollment in the health benefit plan? Well, the first payment is made on the first date selected in the application as long as the e-signature request has been completed. So you have to make sure that e-signature request is completed. And then all future monthly payments are charged on or about the 15th of each month for the upcoming month's coverage. For example, someone enrolls into a plan on March 10th. The earliest effective date is April 1st. Plans always are effective on the first of a month, which covers the month of April 1st through the 30th. On April 15th, the payment for May coverage will be charged. This allows time to resolve any failed payments. Are there waiting periods? Waiting periods are in place for elective procedures within the first 90 days of coverage. That's pretty standard on group benefits. By group benefits, I mean employer benefits. Where can you find links for the network searches? Network search links and instructions for the search can be found in the enrollment platform under the information section. So you log in as the recruiter, which is their term for an agent, and this is what's in there for you, as well as your clients. So they have this in their platform. Always useful when you're rolling a new employee to check their provider and which network they may be contracted with. You probably do this anyway. So I told you what states. They do all states except these 8: Hawaii, Alaska, Washington, Oregon, Minnesota, Maryland, New Hampshire, and Vermont. And what will the health benefits ID card have on it? It will have the LifeX name on it, as LifeX is the employer. It'll also have the name of the insurance entity backing the employer, self-funded plans, benefit health plan, Inc., administrators with the payer ID associated with the coverage. The ID card will have the employee's name, the PPO or EPO affiliate their plan uses, the PPO and EPO logo, along with primary member employee ID numbers. Can a covered person choose between in-network and out-of-network providers? And what happens in an emergency if no in-network provider is available? For VL, that's visit limit plans, because we have visit limit plans and HSA plans. I just showed you the EPO plans again, and I'll show you the slides one more time before we jump off. Covered persons must use in-network providers, except in a true emergency. Out-of-network care is allowed in an emergency room. For major med plans, covered persons may use in-network or out-of-network providers, but out-of-network care typically results in higher out-of-pocket costs. Emergency services under major med plans are treated as O&M, deductible, and coinsurance. So I'll go back and I'll show you these again one more time. This is an overview of these plans. You can take your screenshot if you want to. So that shows you the 500, 750, 1,000, and 1,500. That's the deductible, the maximum deductible. Shows you their out-of-pocket maximum. Shows you the office visit. You see it's all $50. Specialist is $50. Urgent care is $50. Really easy to understand, really easy to explain. Chiropractic's $50. Therapy's $50. Labs are $25 copay after the deductible. X-rays are $50 copay after the deductible. Diagnosis is $200 after the deductible. Telemed is $0. That's primary and urgent care, behavior health. All that's $0. And the emergency room is $1,000 copay after the deductible. See your ambulance, land, air. You see the inpatient cost, $2,500 across the board. So whether it's a $500 one or $1,500 one. So that's why the question, are you more concerned about your premium or your maximum out-of-pocket exposure? And that's what helps drill down to the plan that's going to be right for them. And you see the hospice is $0 copay after deductible. You see the outpatient surgeries. It's a really easy plan to understand. It's a really easy plan for you to explain. And people love the fact that they know what their cost is going to be going into it. For example, you can see on the allergies, $25 copay after deductible. Shows what the prescriptions are. And they have a login to their own platform, just like you have a login to your own platform. And look at these costs. If your target market is 30 to 44 years old, even at the richest plan, we're talking $1,100 a month for a family. I mean, it's a great opportunity. Remember, it's in all the states except 8: Hawaii, Alaska, Washington, Oregon, Minnesota, Maryland, New Hampshire, and Vermont. So it's just right after this webinar is over with, because it's recorded, you're going to get an email. Now, one thing I am going to do right now is I'm going to put in the chat box the contracting link for you. So that's already in the chat box. Now, some of you have questions and you want to talk to somebody, maybe to get a better understanding of how the program works, maybe to have the brochure emailed to you, or maybe you've got a case you want to discuss. So the other thing I'm going to put in the chat box for you is I'm going to put a link where you schedule a 15-minute visit and get any questions answered if you want to. But right after this webinar, you're going to get an email and it's going to have the contracting link in it. When you click it, you'll be taken to the landing page to start your contracting. Don't worry, you can do it in no time. It's really easy to do. Once you get to the landing page, you enter the password to contract. The password is specific. Do not copy and paste the password. The system will not recognize it. Type this password in directly. The password is Atlanta, all small caps. Once you have completed the contract, you'll be directed to a certification page where you'll complete the certification. There's videos, all the training is on there to do the certification. Once you complete the certification so that they know that you understand the plan and can adequately explain the plan, a little bit like Medicare, right? Then you'll get a link to your database, your dashboard within 48 to 72 hours after you certify. And on your dashboard, you'll find your product brochures, your FAQs, network, prescriptions, marketing material, in addition to detailed support and contact information. So when you click that link that I put in the chat box for you, or that you're going to get in the email right after this, when you click that link, this is the landing page you're going to come to. Remember, once you get to the landing page, you must enter this password to contract. The password is specific. Don't copy it because the system will recognize that. It's Atlanta. The code is case sensitive. So it's all small letters. I'll show you the overview one last time so you can see that. Oh, here we go. There you go. There you go. All right, right after this webinar, well, a couple of minutes after the webinar, I have to render the video and you'll get an email. All right, guys, I appreciate you taking the time to get on here today. And go to aeci.us, click on schedule 15-minute visit if you want to talk, or look for the email after this webinar.